Okay, we're on part two of Straighten Up. So if you have not looked at number one, I'd recommend you start with that. But going on, we're talking about forward head posture and text neck. I think I mentioned that a few minutes ago. So there's sort of there is a fact for every inch of forward head posture, it increases the weight of the head on the spine by an additional 10 pounds. One of the things that I try to do when I talk to people about posture and forward head posture is if you carry a bag of groceries, you carry it close to your body. You don't, hold it out here. You hold it close to your body. The reason being, obviously, if you hold something heavy out in front of you with your arms extended, it feels a lot heavier and it engages more muscles, and you have to exert a lot more energy to hold it up there. Whereas if you're close to your body, there's a lot less energy expenditure. It's the same way with your neck. If your neck is forward by an inch, it basically increases that weight of your head on the muscles holding it up by 10 pounds for every inch. So that's a pretty significant thing. And then, of course, it says here on the bottom, it talks about forward head posture can add up to 30 pounds of abnormal leverage on the cervical spine, on the neck, in other words. This pulls the entire spine out of alignment, and forward head posture can result in a loss of vital capacity of the lungs by 30%. In other words, what that's saying is if your head's forward, that increases the pressure on those muscles back up in here, and that can actually affect your ability to breathe correctly. So that's a pretty significant thing. And so forward head posture can cause you not to breathe as well. It also, just posture in general, reduces blood flow and oxygen to the brain and senses by 30%. And of course, it adds a lot of compressive strain to the spine. Other things that can cause compressive strain would be, things like a big stomach, big hips. If you have large breasts, if you're a female, that can cause things like that as well. And it does, because of the extra stress on the spine and the nervous system, can actually make feelings of panic and helplessness be more than they would otherwise. So they can even, poor posture, believe it or not, even contributes to mental health. It's not the only thing, but it does cause issues that way. So here's another little saying: posture follows movement like a shadow. So if you think about what's the ultimate stiffness, it's something called rigor mortis. Of course, rigor mortis, that's what happens when you're dead. If you can't move, you're stiff. You can't move. So going back to forward head posture, there's another saying, the closer your head is to the ground, the closer you are to being in the ground. So again, that's another saying of posture that's has elements of truth to it. So as we look at flexibility and power, so a lot of people, and I find as I age, that the thing that a lot of us that are older battle when we get into middle and older age is we really battle our ability to be flexible. We really battle mobility issues. And so as you age, that becomes more and more of a challenge. And so by having less movement or being stiffer or tighter, that also affects your ability to produce power and strength. If you take a look there at the slingshot picture here, would you agree the farther you pull back the slingshot, the more power that's going to generate? You're going to be able to shoot the rock or whatever it is you're shooting a lot more powerfully, and it will go further. So the more flexible you have, the more mobility you have, you're going to be able to have more power or more strength. So that's the challenge of posture, is getting muscles that have worked over time, that are tight and stiff, loosening those up, and then engaging muscles on the opposite side that are too weak and strengthen those. If you increase flexibility and increase strength, then you have balance, and then you have more ability to move, more ability to be flexible, and in addition to that, you have a lot more ability to produce power and strength. So all those things go together, and they have equal importance. So if movement is the solution, if becoming more flexible, more mobile is the solution, what keeps us from moving? And there are definitely things that keep us from moving, right? One of the big things we see in our office that keeps people from moving well is pain. If a person's in pain, you don't feel like moving. If a person's in pain, you don't feel like exercising. Sometimes people have really good intentions. I really need to get in better shape. I really need to exercise more. So they go to the gym and they overdo it, or they exercise too much too soon, and they injure themselves and make it worse. And then, of course, when you're so sore the next day, or if you injure yourself, then you're not able to, and that sort of takes away your desire to get out there and exercise. So pain is a big deal, and that's one of the things we can assess people for, is if you have pain, definitely we want to get you out of pain so we can then work on the mobility, the flexibility, and the strength. The second thing, and we see this oftentimes in chiropractic, is something called subluxation. Now, subluxation simply means that there is a blockage or interference in the normal flow of electrical impulses from the brain to the rest of the body. And as you can see on the picture, if you take a look at the person's x-ray of their neck, they have a complete straightening of their neck. In other words, you normally have a curvature when you look at the neck from the side, but they have lost that curvature, and oftentimes that's due to previous trauma or an old injury. So that's one thing you definitely want to address, is getting a curvature back in the spine, because if you have that, then you're more prone to injuring yourself because of the excessive stress or forward head posture or both. And the other thing you're more prone to is concussions. If you have a straightening of your neck like that, you're more prone to concussions because your body doesn't have that ability to absorb shock near as well. That's why you have curvatures in your spine, is to absorb shock. And then, of course, forward head posture, like we were talking about, causes a lot easier for you to have subluxations. So subluxations, if you talk about the brain produces energy. And one of the things that powers the brain is movement in the spine. But if you can't move, then you can't energize your brain near as well. And that's where chiropractic comes in. One of our main goals is to detect subluxation and then correct it as best we can, or optimize it, maybe is a better word to use. Once you optimize the movement of the spine and the alignment of the spine, then your body's in a lot better state to increase flexibility, to increase mobility, and to increase strength over time. So as we look at subluxation, we think of all those joints, the 53 joints in the spine, and all those areas of the spine have nerve supply, both on the right and on the left. And so as we look at this next slide, if we look at the upper neck here, if you see it says upper cervical, upper neck, C1 and C2. So what it tells you straight across from there is what areas are affected. Now, significantly enough, it talks about the immune system. There are connections in the brainstem that help mediate immune response. Now, immune system is complex. It isn't only the nervous system, but a lot of people don't realize there is a connection with the nervous system and the spine. And that's one of the reasons we encourage people through this time, especially during flu and cold season, and then of course with this COVID-19 thing going on, is to get your neck adjusted, because that will help your body help your nervous system be able to better mediate the immune response. And of course, the food we eat has a lot to do with it, the environment we put ourselves in, the amount of stress that we're under, whether that's physical stress, whether that's emotional stress, whether it's chemical stress. All those things are stressors on the body. So we want to make sure that our immune system is optimized. Maybe that'll be another topic for a talk here online, is how to improve your immune response. And we do have a video that was done through 8 Weeks to Wellness with a Dr. Silverman that I mentioned, so you might want to refer back to that. But back to our nervous system here. So if you look at the mid and lower neck, all those nerves go to the neck, shoulders, thyroid, tonsils, that whole upper area. And then in the thoracic spine, in other words, the mid-back, we have innervation to the arms, hands, heart, and lungs, bronchial tubes, and then the internal organs of the body, as you can read there yourself. The lumbar spine, alignment of the hips, the lower intestines, the appendix, the abdomen, bladder, reproductive organs, and obviously the lower back. And then in the sacrum, the tailbone, the coccyx, it's the hip bones, tailbones, and buttock region. So depending on the area of the spine that's subluxated, you can have pressure on the nerve supply, and wherever that nerve supply goes, you can have any particular kind of symptoms or problems that, are seen. So when we adjust you, we're actually having a positive effect on your nervous system. And that's something people think chiropractic is just for neck and back pain. And yeah, it does treat it very well. But if you're really going to get in there and optimize your human function and the function of the nervous system, you want to make sure that your subluxations are cleared. And then if you work on your posture and your alignment that way, then you get even better results. So let's see what's next here. Okay, so let's talk a little more about forward head posture. So the picture of the fella here, you see there's a before picture on the left and an after. This person happened to do 8 Weeks to Wellness, which we won't get into a lot of that, but that's an overall program that is, again, move well, eat well, think well. It addresses all of those. It's an 8-week program to get you going back in the right direction towards health versus going toward disease. So anyway, this person, you can see there's quite a difference between the first picture and the second picture. And as far as posture, if you take a look at the top of his shoulder here, and his ear is quite a ways forward. And then if you look at the second picture, well, his ear is a lot more directly over his shoulder. And again, a lot of times, depending on the person and their age and how things have gone, you can make some significant changes in only 8 weeks. You may not be able to completely fix the problem or correct it, so to speak, but you can definitely get them going in the right direction posture-wise. If you give them the right exercises to do. And this person with the 8 Weeks to Wellness, the 8 Weeks to Wellness does change your diet. And of course, that looks like it helped him some there with his stomach, but there's a significant difference in his posture. And I think most people would agree. But if you do, how do you know you have forward head posture? Well, one thing we can do is take a posture picture of you, which is simply a front to back picture and a side picture, and it's in an app, and then the app will take your posture, make some measurements, and then we can tell you, how far off you are, or how much of a hill we have to climb, so to speak, to get you moving towards optimal posture. So this particular individual was a patient of Dr. Donahue's, and he tells the story of he was one of the guys that would come in periodically, would come when he hurt, and he'd say, "Oh, I know, Doc, it's my L5. Please adjust my L5. Well, this fella had a lot more problems than just L5, obviously. Looks like we're running up against the time, so I am going to stop the recording here. And we will move on. In number 3, look, I think we got another 10 or 15 minutes left, so we'll move on here to number 3 just shortly. Thanks for listening.